Welcome to this module on Clinical Decision Support Systems. Clinical decision support tools have been developed to provide the right information to the right person at the right time and at the right location. The National Quality Forum has defined them as any tool or technique that enhances decision-making by clinicians, patients, or their surrogates in the delivery or management of health care. So what does that mean? A CDS tool consists of a trigger, input data, interventions, and the action step. For example, a trigger such as ordering an antibiotic is an event that signals a CDS algorithm. The simplest types of CDS tools are medication alerts. In this case, the algorithm instructs the system to look at the creatinine results, other medications for the patients, and the patient's age. The interventions are the possible actions that would be suggested to the provider given the type and dose of medication she entered and the patient's data. In this case, the suggestion could be to choose a different dose because of the age or creatinine level, or to choose a different antibiotic because of its interaction with other medications the patient is taking. The action step would be what the provider decides to do based on the suggestions provided. This type of point-of-care alert is common in most medication ordering systems. This type of point-of-care alert has been known to cause alert fatigue when there are too many alerts that are not clinically significant. Advanced practice nurses should give feedback about the overuse of alerts so that informaticists can work on improving the logic behind the alert or prioritizing the alerts. Other categories of CDS tools are order sets, relevant reference information, expert systems, suggestions for parameters, reference to guidelines, templates for documentation, and the event-driven alerts I've already explained. Order sets present the most common orders for a specific condition. For example, for a client who is being transitioned to comfort care, a set of evidence-based interventions can be presented to the clinician who is writing the order. She doesn't have to remember all the single orders that go into transitioning the patient's orders. Another example is the provision of information buttons at specific times in the clinician's workflow to provide healthcare guidelines or up-to-date references from within the electronic health records system, rather than forcing a clinician to go outside the system to search for information they need. Other tools that have been developed are workflow support tools for discharging a patient to a different level of care and medication reconciliation tools. Why is this important to advanced practice nurses? The DNP graduate should be able to evaluate the evidence and implement the best evidence into practice to change patient outcomes. Clinical decision support tools are one way that information technology can support the translation of evidence to practice. If you want to make sure that the clients at your clinic have their current A1C values, you could add this reminder when the provider opens the chart. If you want to make sure the providers have the latest information from evidence summaries and guidelines, you need to make this information available in the EHR when clinicians are making decisions on their clients' care. CDS tools are often only provided in fully functional electronic health records, and each vendor may configure the CDS tools in a different way. Therefore, there are barriers to having a knowledge base that is kept up to date with the latest information and is used effectively. The use of CDS tools and interventions are in their infant stage. It will be important for advanced practice nurses to find ways to translate their work into relevant information that is available to all clinicians at the right point in their workflow.